So how does AI work? How does AI work? In a nutshell, it analyzes data and recommends actions to improve outcomes. It's just that simple. Now, I want to talk about this fantastic example, and anyone who's been reading about AI and knows about it has heard this already, so I apologize. For those of you that don't, this is fantastic. So an AI system for breast screening was developed in the United States, and it spotted more cancer and raised fewer alarms. So it's really interesting because a university hospital took a big database of X-rays, digitized them, and looked at the people involved and tracked their outcomes with various and what happened. And what they found was AI was starting to pinpoint potential for cancer that the original radiologist did not see. But when they showed it to the radiologist, they scratched their heads. They said, you know what, this makes a lot of sense. And at least some cities, it's almost gone entirely this way. So I don't know how widespread this has been yet, but we can expect that most breast cancer screening should transition to AI enabled if it isn't already. One last thing, this fantastic example I wanted to tell you about. You can find it on the Intel website. One of their leading AI software developers developed cancer, and he took the treatments that were out there, but they weren't working, and he was told that he was terminal and he didn't have long to live. So he decided to talk to a university with a medical program, and together they got access to a database of people that had cancer and all the people's information, what kind of people they are, their DNA profile, what their treatments were, what their outcomes were. And he fed all of that information into a database. And lo and behold, the AI determined that actually cancer, the outcome of cancers varies with the person who has it, especially their DNA. And the program recommended to him a different regime of treatment than he had tried before. So he talked to his doctor, got that all set up, took the treatment, and lo and behold, he went into remission. I didn't follow up on whether he's still healthy, but I do know that is spreading everywhere. And even in my home city, there's a clinic that's offering that type of analysis. So it's really a great story.
It's funny because, Dave, even in dentistry, the recommendation is to get an X-ray now every, I don't know what it is, 2 years or 3 years. And that's what they're going to be using that for.
Okay,
let's look at all the illnesses and let's look at all the diseases you can get of the mouth. Interesting.